Okay, for this slide, as you guys can see, there is three methods in order you want to control the bleeding. So the three methods are direct pressure and elevation. The second method is the indirect pressure, and the third method is using a tourniquet. Okay, non-medical professional also freely to participate in this, and they are allowed to use the skill on a real patient, an emergency, or a disaster situation. Okay, for the direct pressure, as you can read in the slide or you can see in the slide, basically the direct pressure is used for the skin injuries, and the step that you need to do in this method is you need to compress or you need to push at the area of the bleeding by using a bandage and also elevation. Okay, this this step is to make sure if you want to injure the blood flow, to ensure the smoothly of the blood flow, and also you want to avoid the inflammation, you can place the area of the wound until it reach the heart. Okay, for the indirect pressure is the internal injuries that we cannot be seen by the outside, and these internal injuries such as leaks from the blood vessel and also from the organ. Okay, the third method is the using a tourniquet. Tourniquet is basically the injury that serious. Okay, you only use this method if the injury is serious. The step that you can do in this method is you need to tie up the tourniquet over the wound so that it can reduce the blood loss. Okay, now we move to the direct pressure and also elevation. Okay, in this method, as you guys can see here, this is hand and this is the sterile dressing, and the circle one is the for example, this is your wound. Okay, so firstly we need to cover the wound with a sterile dressing. Okay, if the sterile dressing does not have on that time, you just can use the clean clothing. Okay, do not waste your time. And then second, you firmly press over the dressing with your fingertips at the side of the bleeding, and then you need to elevate the bleeding part until bleeding part above the heart level. Okay, in this point you need to remember, because this is important, if you see the dressing is soaked with blood, it's okay, you just need to apply with another bandage or dressing, and so that we can prevent the blood from start again. If necessary, you can use the pressure you can use pressure on the dressing with a pressure bandage. Okay, so the next slide is the video that can give you more understanding on this method. Okay, next we move to the indirect pressure. And now we move to the next slide, which is the indirect pressure. So when the direct pressure and elevation does not control the blood, and then indirect pressure must be used. Okay, by applying a pressure on a pressure point, it can be effectively in order you want to control the blood. But you should not replace the indirect pressure for direct pressure, because both will be used at the same time, for which mean that if the direct pressure does not effectively, which mean the blood is still cannot be controlled, and then we directly move to the indirect pressure. And then when you use the pressure point, you need to use it with caution, because this indirect pressure can cause a damage. And if you suspect the bone below the artery is injured, then you should not use this indirect pressure. And then the most common pressure point is the brachial and also femur. Okay, so the next slide is also the video that can make you more understanding regarding with the indirect pressure. Okay, on the first point, using a commercial tourniquet or improvise from a strap, belt or handkerchief and any other materials that at least 2 inches wide. And then, but do not use wire or cord that or anything that can make a cut into the flesh. Okay, place the tourniquet 2 inches above the wound. Okay, so let's say the wound is here, and then you must place the tourniquet 2 inches above the wound. And then, if possible, do not apply the tourniquet directly to the skin, and then it may twist or pinch the skin and tissue. But you can use a padding or a thick pad on the tissue that will be compressed. And also you need to write note about the location of the tourniquet that been applied and the time when you apply the tourniquet, and also the victim vital sign when you apply the tourniquet, so that it make easier for the EMS to look forward. And then, and you should not loosen or remove the tourniquet unless it's under direction of physician. Okay, for the first step that you need to do for the first aid treatment for the nosebleed is you need to make sure the person is sit upright, and then ask them to feel their head forward. Okay, use the thumb and forefingers and then squeeze their nostril shut. Okay, hold for at least 10 minutes. Okay, hold for at least 10 minutes, and then after 10 minutes release it gently. Okay, release it gently and check for the blood. Okay, advise them not to blow their nose or picking for the rest of the day. Okay, but if the blood continue beyond 20 minutes or the nose start to bleeding again, you must seek for the medical treatment. Okay. Okay, the next slide is the first aid of minor bleeding. So what are the first steps that you need to do if you have a minor bleeding? First of all, you need to clean clean the injured area. Clean the injured area with use sterile gauze and soak in with the saline or clean water, and do not use the cotton wool. Next, apply an appropriate dressing, which means use a band-aid or adhesive dressing. The third step is see if we can clean the dirt by ourselves, which means we need another treatment from a doctor. Take a booster vaccine if necessary, which means if the wound become worse, and then the person need to see a doctor.
First aid for open wounds. First, stop the bleeding. By using a clean cloth or bandage, we can apply a pressure to the wound to promote blood clotting. Second, clean the wound. Use clean water to flush any debris or bacteria. Once the wound clean, we can pat it dry with a clean cloth, and then you may need a doctor for surgical debridement to remove any debris from severe wounds that contain dead tissue, glass, bullets, or other foreign objects. Fourth, treat the wound with antibiotics. After cleaning the wound, please apply a thin layer of antibiotic ointment to prevent infection. Fifth, close and dress the wound. For your information, close clean wounds helps to promote faster healing. For the deep open wounds, it may require stitch or staplers, while for minor wounds, you can use waterproof bandage and gauze. However, please leave an already infected wound open until the infection clears. Lastly, routinely change the dressing. Based on the Centers for Disease Control and Prevention, which is CDC, they recommended to remove the old bandage and checking for signs infection every 24 hours. And remember to keep the wound dry while it heals.